Permanent Cosmetic Color Correction and Adjustment Guide. How to adjust the healed colors. Permanent Cosmetic Color Theory, or PCCT, does not apply the complementary pairing of colors like traditional color theory does. The following applies. For instance, orange complements or corrects or neutralizes green and blue colors, including gray, but in PCCT, blue is not used to complement or correct orange. Yellow complements or corrects or neutralizes violet, but violet is not used to complement or correct yellow. And green complements or neutralizes orange and red, but red without a bias toward orange is not used to correct green. So knowledge of permanent cosmetic color correction and adjustment techniques is important. While a technician may decide not to offer correction services to people who were not their original clients, over time, it will be necessary to apply these skills to adjust and correct color that the client did not take care of properly, and a host of other situations they may encounter. The following examples require knowledge of color correction adjustment techniques. For instance, clients who request correction services as a result of poor color choice or adjustments needed due to color shifts resulting from chemical exposure like facial products, lack of sunscreen protection, or changes in skin undertone classification, or adjustments needed after an initial procedure has healed and the color requires a slight modification to a warmer or cooler version. So, for example, correction services on work previously performed by another technician. It's not uncommon for prospective clients to request color corrections after they have been previously tattooed by someone other than the person conducting the correction procedure. These corrections are often the most difficult to analyze and often involve design correction as well. Under these circumstances, the correcting technician is normally not aware of the original formulation, manufacturer, or color utilized for the original procedure. So the technician bases their evaluation process on what they see, the client's skin undertone, and an unacceptable color. This puts the technician in a position of attempting to analyze the characteristics of an unknown color and forming a plan for correcting the color to the client's specifications. The first question to the client will be, why are you not returning to the original technician for the correction work? This is important because the original technician has all the historic information necessary to make color correction choices easier. Many times the answer will relate to dissatisfaction on the client's behalf. They have lost faith in the original technician and refuse to return for additional work. But be very cautious about being involved with conversations regarding a client's previous experience with another technician. Even though a disgruntled client may speak freely of their version of the previous relationship, as there is no way of knowing what really transpired between the client and the original technician, it may very well be that the client is as much responsible for the poor color choice as the technician. Although in most instances, technicians who are well-trained will refuse to follow through with unwise color choice requests. The client also may not have cared for the procedure as directed. So the bottom line is, without historical information at hand, important data needed to work with confidence on another technician's work may not be readily available. So proceed with caution, if at all. If possible, obtain the original brand and specific color used. Once a technician has this information, the manufacturer or distributor can be contacted and important questions asked. This, accompanied with an analysis of the person's skin undertone, may reveal a lot of information as to why the color appears as it does. Unfortunately, more often than not, technicians do not have the benefit of any prior information from the client's previous technician or what could be considered 100% accurate information from the client. They have to make a decision if they can correct the color to the client's satisfaction based solely on what they see. In the next example, adjustments needed due to color shifts resulting from chemical exposure. Color changes may occur as a result of chemical exposure. So your anti-aging facial products, as an example, unprotected procedures exposed to the sun, tanning beds, and other known contraindications of permanent cosmetics. Under these circumstances, a technician may see an undesirable or prematurely faded version of the original color. Every individual colorant in a formulation has a life. Particular colors are mixed together by the manufacturer in anticipation they will age in a similar manner over time. Environmental stress factors can disrupt the normal aging process of a color, resulting in the need for color correction work. Also, for consideration, is the skin's maturing personality. As the skin ages, the classification of undertones is subject to change. For example, a peaches and cream complexion can later in life appear rosy or ruddy, for instance, and the skin thins and the vascular system is more influential on the classification of skin undertone. So the client may very well have originally received the correct color choice at the time, but in concert with the maturing process, the properties of the skin composition, and the classification of skin undertones may have been changed. Skin undertone changes affect how the color is seen through the filter of the skin. Over time, as a client returns for the subsequent refreshers and an unexpected aged and faded color is seen, technicians often fault the manufacturer of the color that was originally used. In reality, it is possible that neither the specific color brand nor the technician's original choice of color may be the source of the problem. The shift in color appearance may very well be as a result of a change to the client's skin undertone, chemical exposure, lack of good maintenance on behalf of the client, excessive sun exposure, and a multitude of other possibilities neither the technician nor the formulation manufacturer has any control over. There are many actors in the theater of colorant and the formulation behavior. The following guide refers to correction colorants, and depending on the brand, may have a specific name, such as a modifier, an anti-whatever, an anti-blue, an anti-green, or adjuster, or a warm-up, or a variety of other descriptions. This indicates a color that is made specifically for color correction or adjustment purposes. The existing color that requires correcting and color adjustments, as outlined in examples 1 and 2, follow the same technique processes. If it is an eyebrow color seen as warm, like a red or orangish color, you'll want to use a cool green correction colorant. There are different shades of green. However, if the eyebrow color is like a cool blue or a gray, green, or black, you'll use an orange correction colorant. There are different shades of orange too, including yellow-orange. However, if the eyebrow color is cool violet, use a yellow correction colorant. There are different shades of yellow, including a more neutral yellow and a yellow-orange. It's at this juncture a decision must be made. There are two choices for consideration. The optimal decision would be to tattoo the correction color and allow the correction procedure to heal. At the follow-up appointment, analyze whether or not additional work is needed with the correction color. If not, proceed with the choice of color that meets the client's expectations, often referred to as a target color. The second option is to take a chance that tattooing the correction color and the choice of a color that meets the client's expectations, or target color, at the same appointment will be effective. So this can be risky depending on the density of the procedure to be color corrected. So if, when the client returns for the follow-up appointment, additional correction work is needed, this further correction is now more complex. Color is seen as a result of the combination of the correction and the target colors, and the skin has limits as to how much tattoo color it will effectively hold. If the eyebrow color is cool blue, gray, green, or black, use an orange correction colorant. There are different shades of orange, including a yellow-orange. But if the color is cool violet, use a yellow correction color, and there are different shades of yellow, including a more neutral. And finally, if the client presents green brows, you're going to want to use a brown color with a base of an orangish color in it. If the color is quite dense, laser or tattoo removal techniques both are dependent on if considered appropriate for the procedure, and the client's Fitzpatrick skin type needs to be considered. It's highly oversaturated. The shape is just way out of bounds to what looks natural and attractive, or it's just too dark and it's just too heavy. You may want to just remove it out of their skin altogether with a laser treatment, or even a saline solution, or another type of solution tattoo removal method. So eyeliner colors. Eyeliner color corrections are not as common or as challenging as eyebrow or lip liner corrections. Typically, the eyeliner is refreshed with a black or brown or black-brown charcoal or the original fashion eyeliner color. And that seems to elevate most of these type of corrections. An exception to this would be what is called French eyeliners, where white or some directive of white has been tattooed over the eyeliner color to highlight it. The color white is nearly impossible to redirect to another color. Lip liner color corrections. If the lip liner color to be corrected is blue or violet, use an orange-based corrective formulation. There are orange colors that are more neutral orange or red orange, and some that are more yellow orange. So again, this is where your knowledge of color theory comes into play, because you have to really look at what the client is presenting. If it's a deep dark purple, you're going to want to use a very bright, almost neon orange to correct that color, just to neutralize it. If it's a soft, kind of coolish bluish color, then you can use a softer orange to, bring it back to neutral. The selection must be appropriate for the lip color in question, and there are many to choose from. So if in doubt, contact the manufacturer or the distributor for advice. If correction formulations, which are sold under various descriptions, are not available in the formulation line used, the manufacturer or distributor can be contacted for advice. Many times, manufacturers will offer color correction advice that leads technicians to the use of a warmer, cooler, or more neutral color in their existing line as appropriate. Color corrections and adjustments can be made successfully achieved if the technician is well trained in the artistic application of permanent cosmetic color theory and is knowledgeable about the formulations used and works conservatively. Many times, color corrections and adjustments require multiple sessions to achieve the desired result. For the lines that we have mentioned, the pigment lines that we have mentioned so far, such as LI, Premier Pigments, PermaBlend, I believe they do all have corrector color available. What you also could be dealing with if you are presented with purple lips is what's called hyperpigmentation. Black skin is 60 to 70% higher in lipid content than white skin and has larger sebaceous glands. A layer of cells in black skin, although thinner, has a higher concentration of cells than in white skin. So because the stratum corneum is therefore denser in black skin and the oil glands are larger, black skin is much more prone to lesion formation through follicular impaction. And this quote appears in Christine Heathman's article, Acne and Skin of Color. That was published in Dermoscope magazine. Black skin appears thicker than other skin because of its compact nature with more cells per layer. When trauma, injury, or disease occurs in black skin, the melanocytes will do one of two things as it's healing. It will either hyperpigment, where the skin will produce more melanin, creating darker pigment in areas, or it will have hypopigmentation. So that means the skin will stop producing pigment, leaving a white area. So another issue is that is more prone in black skin is a risk of hypertrophic scars and keloids, which are another overproduction of scar tissue that can vary from a little to a lot of bulbous formations on the skin in the area of trauma and spreading beyond the trauma site. If a person is prone to keloid scarring, both black and white, that person should not get permanent cosmetic treatments performed. Hyperpigmentation. Depending on ethnicity, clients that have a propensity to hyperpigment or have darker skin complexions may be subject to hyperpigmentation after their permanent makeup or scar camouflage treatments. So technicians need to be aware of post-inflammatory hyperpigmentation in regards to all permanent makeup applications and plan their procedures accordingly, and discussing this process with the client so they can adjust their expectations accordingly. We prefer that our clients use Skin Medica's Lytera. It's a medical grade product by the makers of Botox and Juvederm, so we suggest applying it for 2 weeks prior to the treatment and continuing for the next 4 weeks to prevent these hyperpigmented areas from occurring when you are planning on working on a darker skinned person. So many times after a lip color application, that seems to be fairly common, and so normal skin color may return slowly after a period of months. So this occurs in Caucasian skin occasionally, although it will most likely occur on clients with heavy concentrations of melanin in their skin, so darker skin. Educating the clients on proper use of lightening procedures to be used on their lips is imperative, as many products will remove the pigment color as well as lighten up the hyperpigmentation.